Hello, I'm Richard Ibbotson. I'm the Director for Autism Network Scotland, and I'm delighted to welcome you to the Scottish Government's annual Autism Strategy Conference for 2020. Obviously, this year is different. It's the 8th Autism Strategy Conference that the Scottish Government have run, but this year is obviously very different in that we're not delivering this on a face-to-face basis and we're doing this remotely, and we welcome you to the conference. The nature of doing this differently this year is sad because we miss out on the opportunities for networking and face-to-face contact that a live conference would have given us. However, there are some advantages as well. We have far more presentations available to see than we would have been able to squeeze into a one-day live conference. And it also allows us an unlimited number of delegates to access the content of the conference, which is very exciting. So we've got a wide range of presentations to offer to you today. We have presentations from autistic people's organisations and from the large national charities, autism charities working across Scotland. We have presentations from the Scottish Government's key strategy delivery partners, NATE, NES Scotland, Inspiring Scotland, and of course Autism Network Scotland. We also have presentations from the charities that have been funded as part of the Autism and Understanding campaign, which is being launched today. All those charities are presenting on their work and their projects that relate to that campaign. We have presentations looking at recent developments in diagnosis. The overall theme for the conference this year is autism and human rights. And whilst all presentations reflect on that, specifically contributing to this theme are presentations around autism and advocacy. We have David Cobb from Arnott Manderson Associates Advocates, Legal Advocates. We have a presentation from the Mental Welfare Commission and a presentation on a partnership project between Swan Scotland and Police Scotland. We have a couple of keynote presentations. Dr. Damien Milton will be talking about autism and the double empathy problem, and Andy MacDonald from Studio 3 on the reflective journey. There is a separate presentation from the Scottish Government on the Different Minds One Scotland campaign, the Autism and Understanding campaign that is being launched today. And I suggest that's one of the first presentations that perhaps you look at. All these presentations can be accessed by the Autism Network Scotland website. There's a conference page on that website and all presentations are included there and you can scroll through them and access them all. Having said that, 30 plus presentations is going to take a long time to work through them all. We don't expect anybody to do that today. All those presentations will be up there for a number of weeks for you to view at your leisure. The other opportunity that this year's virtual conference gives us is a better way to engage with people around questions and comments from the presentations. If you have any questions, and we really encourage you to do that, or comments around those presentations, please email autism.network@strath.ac.uk, the Autism Network general email address. You have up to the 23rd of October, Friday the 23rd of October at midday to submit your questions and comments. We will then be summarising those questions and comments and putting them back to presenters, recording those and publishing those again on the website the following Friday, that's the 30th of October. So this gives you, the audience, quite a good opportunity to engage with the content of the presentations and to feedback on those and ask any further questions from the presenters, which we will then collate and present back. So welcome again to the conference. I hope that people enjoy the content and that you enjoy this way of engaging with the Scottish Government's autism strategy. And on that note, I'm going to hand over to Annette Pyle, who's the team leader for autism at the Scottish Government.
Thank you, Richard, and good morning everyone, and welcome to the Scottish Strategy for Autism's 8th annual conference on the theme of autism and human rights. I've been asked to do this opening welcome ahead of our formal welcomes by the Minister for Mental Health, Ms Hockey, and Councillor Curry from COSLA. I'm Annette Pyle, and many of you will know me from one of our annual conferences before. I work in the Autism Policy team in Scottish Government, and I've been proud to have been involved in the strategy for autism since just before we launched back in November 2011. I'm always delighted every year to work with Autism Network Scotland in the planning and delivering of our conferences. We had planned to have this conference earlier in March this year and hoped to welcome over 300 delegates in person. However, when we began planning that event back in November 2019, little did we know that what was about to happen that would change our lives in many ways. It has been a challenging and anxious time for everyone in Scotland, but we can all be proud of how we have followed public health messages and helped to keep safe. However, whilst a lot has changed, what we have learned since March is to innovate and adapt. So this year's conference is not following the same day format as was planned for March. Instead of over the coming days, we will be showcasing 30 presentations from a variety of speakers and organisations on the theme of autism and human rights. So on the positive, if we have been doing this in one day conference, we would not have had the time to cover all these presentations. Also, our annual conferences have grown in size year by year, and due to capacity, we have always had a waiting list as we've been unable to cater for everyone who wanted to attend. So this year it's online and allows everyone who wants to access the conference the opportunity to do so. And I'd like to welcome those of you who are new delegates to our Autism Strategy Conference. Welcome those who are joining in from all over Scotland and beyond. And with the digital platform, it's possible to reach worldwide, and that is exciting. In Scotland, we're always willing to share what we are doing whilst recognising that we don't often get it right first time, but that we are committed to improving the lives of autistic people in Scotland. We want Scotland to be the best place for autistic people to live. As part of that, we want to promote equality and uphold human rights. We want to ensure that every member of society is able to live with dignity and respect. It is important for me to say that effective legislation plays a vital role in ensuring that the rights of everyone are respected, protected and fulfilled. These include the important rights set out in the United Nations Convention on the Rights of Persons with Disabilities and other international treaties. You will be able to learn more about the Scottish Government's commitment to reviewing our mental health legislation in one of the presentations. As I said earlier, there are 30 presentations to access, and they are all on the theme of autism and human rights. So we have something to interest everyone, from reviews of legislation, peer support, practice improvement, employment rights to advocacy. Whatever you're interested in, we have something to interest you. Some of the presentations are linked directly to the implementation of the Scottish Strategy for Autism, and this enables you to learn more about how the strategy priorities are being delivered. You will learn more about that in the Minister's Welcome. I'd also like to highlight our Deputy Director's presentation, in which Hugh McAloon chats to Marion McLaughlin. Other presentations worth watching out for are Inspiring Scotland's presentation on our campaign work, Nate's presentations on the work that they have been doing improving practice across health, social care and education. Some of the campaign-funded projects are also presenting: Perth Autism Support, Swan and AAA's, plus many more presentations, too many to mention. Please check out the presentation guide for further details. The guide to the platform is that we are not there in person and finding out about what is happening on the ground in our communities across Scotland. However, you can still be connected to professional networks through Autism Network Scotland's website and also Nate's Third Space website for inclusive practice. Of course, the good thing about attending a conference in person is the free coffee breaks and lunch. Unfortunately, on a digital platform, that's not possible, so feel free to dip in and out of the presentations over the coming days, and don't forget to bring your own coffee and snacks. I hope you get the opportunity to enjoy as many of the presentations as you can and that you find them informative. Please feel free to tell other friends and colleagues about this conference, as we'd like as many people across Scotland and beyond to have the opportunity to see what's happening in Scotland in terms of autism and human rights. I hope you enjoy, and thank you.
That's great, thanks Annette. I'd now like to introduce you to our Minister for Mental Health, Ms Hockey.
Good morning, ladies and gentlemen, and welcome to what is our 8th National Autism Conference on the theme of human rights. Although we're participating in the conference virtually, and indeed over the course of this week, it's a pleasure to be with you this morning. I'm sure that you're all looking forward to this week's programme, which being online has allowed us to provide a more enhanced programme of speakers and topics. Firstly, I would like to thank Autism Network Scotland for their hard work in making this event happen today. Normally our conference takes place at the end of March in the run-up to Autism Awareness Week. Unfortunately, the COVID pandemic meant that we had to delay our original conference scheduled for then. I'm aware that the restrictions put in place due to the pandemic were particularly hard for autistic people and their families, with normal routines changed dramatically. Whether that be due to schools being closed and parents having to homeschool, people having to work from home, or indeed not being able to work at all, and the closure of support services which autistic people and their families use. Although we missed out on the opportunity to hold activities during Autism Week in April, it's still vitally important to continue to help the public understand autism, to be more understanding and accepting of the different qualities and attributes of autistic people. That's why, as we committed to in the autism strategy, today we are launching our Different Minds, One Scotland campaign. The campaign aims to give a clearer understanding of autism and is stage one of a 3-stage programme of work. The campaign has been developed to raise awareness amongst the general public and is being launched following robust and detailed development with autistic people and organisations which support autistic people. Autistic people have been involved at every stage of the campaign and have contributed to its development. We are excited to finally launch the campaign today, and I would like to thank the autistic people's organisations and individuals involved in the development. You'll be able to hear more about the campaign development and the involvement of autistic people during the conference week. As Minister for Mental Health, I've been fortunate to meet with some of you and your organisations. I congratulate and thank you for the work that you do, and even more since March and the period of the pandemic. I know your support is of vital importance in helping autistic people live healthier, happier lives. I'm struck by the passion in this community and the dedication shown by everyone for doing the right thing for autistic people all over Scotland. I'm delighted that COSLA, our strategy partner, is also presenting during the conference. We continue to work with COSLA on delivering our joint strategy, and together we want to deliver real change for autistic people, their families and their carers. During the course of this week, you'll hear more about our plans for the last 6 months of the autism strategy and some of the great work that is happening in Scotland. As many of you will know, this time 2 years ago, the former Minister for Mental Health, Maureen Watt, launched the priorities for the final phase of the Scottish Strategy for Autism through to 2021. Today we have a number of speakers involved in shaping and delivering those priorities. I would like to thank all of our speakers and presenters for kindly agreeing to share with us today their insights and their expertise. You'll hear more about our priorities throughout the course of the day. For now, I would like to touch on just a few of those highlights. At our conference last year, I announced the commission of a National Autism Implementation Team. The team have been doing some amazing work on improving the diagnosis of developmental conditions across the lifespan. And the team consists of multidisciplinary professionals who work across children and adult services to share best practice and improve services and the experiences of those using those services. As part of this, as mentioned in our recent programme for government, NAIT have been working with the Royal College of Psychiatrists and have produced a draft national clinical pathway for ADHD in adult mental health services. The pathway will now form part of a feasibility study in all NHS boards in considering the practical consequences of implementing a national clinical pathway within their locality, with recommendations being made on how it can be taken forward nationally. I hope that you will agree that this work is vital to the development of adult neurodevelopmental pathways, assisting clinicians to diagnose ADHD. We know that the experiences autistic children have in school are vital in ensuring positive outcomes, and central to that is ensuring teachers understand autism and that they know how to best support each pupil individually. Last year, working with Education Scotland, we refreshed and relaunched the Autism Toolbox, a resource for teachers and support staff. During the COVID pandemic, the expertise of NEIT was vital in the development of resources to support autistic pupils continuing their learning at home. And we are also working across government on a response and action plan following Angela Morgan's review of additional support for learning. You can learn more about our work on supporting autistic learners in the NEIT presentations. At the last conference and in our programme for government in 2019, we announced the development of a more consistent approach to the support given to newly diagnosed autistic people and their families. It's clear from the COVID pandemic that support services for autistic people and their families have had to change, and they will have done so while still providing vital support. In response to the COVID pandemic, we provided funding to Scottish Autism and the National Autistic Society to allow them to extend and adapt their existing helpline and support groups to ensure that autistic people and their families continue to receive support. The COVID-19 experience has shown the capacity of the third sector to be flexible and to adapt to change and deliver high-quality support. It has also to be acknowledged that it has shown some adaptability of many autistic people who have managed in extremely trying circumstances. Some of the adaptations made are fundamentally better suited to many autistic people, with the use of video calling, live web chat, etc., minimising the need for face-to-face interaction. There is therefore an opportunity to establish a national post-diagnostic service that draws on the lessons learned during COVID-19, that involves several partners working collaboratively to provide support. And on this basis, I'm happy to announce that we are providing funding of around £250,000 to develop a pilot national post-diagnostic support programme for both adults and children. This programme, led by Scottish Autism in partnership with the National Autistic Society and Autism Initiatives, will build on the excellent support services already provided by these organisations and provide a national support provision accessible to autistic people and their families across Scotland. We envisage the national service will enable families of newly diagnosed children to feel informed and empowered to support their child, enable individuals diagnosed as autistic to embrace their identity, provide support on a range of issues such as disclosing a diagnosis and practical help such as benefits, and connect autistic people with peers. Each of the organisations has areas of expertise that when combined will address the needs of autistic people, and further details of this programme will be available as soon as work develops. The pilot will be independently evaluated to determine the outcomes for individuals, and this will inform our decision making going forward. I look forward to working collaboratively on this and seeing how this work develops. I know how vital this support is to autistic people and their families in understanding their autism and what it means to them. There is much to talk about in what is happening in autism across Scotland. And while this is all very positive, I know there is still a long way to go in making Scotland a better place for autistic people. Working together on this agenda is important. The Scottish Government can't deliver this alone. I want us to continue to work together in delivering our priorities. I know that autistic people and their families face barriers in communities and in accessing services that understand their autism. However, I do believe that the work I've announced today and the other work which is being taken forward as part of the strategy will make a difference to the lives of autistic people in Scotland. Thank you, ladies and gentlemen, and please do enjoy the rest of the conference.
Thank you, Minister. I'd now like to pass over to Councillor Stuart Curry, the COSLA spokesperson for Health and Social Care.
Hello everyone, my name is Stuart Curry. I am here in my capacity as COSLA's spokesperson for Health and Social Care. I was originally due to speak at the annual conference in March, so I'm delighted that the conference has finally taken place. I'm sure we're all getting used to, well, mostly getting used to remote and virtual events, and with Autism Network Scotland managing the conference, I'm absolutely confident it will run very smoothly indeed. To give you some background, I'm the chair of COSLA's Health and Social Care Board. Our board's membership is made up of one councillor from each of Scotland's 32 local authorities. These local councillors have responsibility for health and social care in their area. COSLA stands for the Convention of Scottish Local Authorities, and we are the representative voice of Scottish local government. Now, COSLA were the co-authors, along with the Scottish Government, of the original 10-year Scottish Strategy for Autism in 2011, and the updated outcomes and priorities in 2018. With local authorities responsible for the provision of many of the services which support these priorities and outcomes, either directly or through commissioning others to do so. I know there is a wide range of needs given the spectrum nature of autism, which covers multiple sectors of local authority work, which are not all within the gift of health and social care. For example, education, housing, transport and employment. We have a number of full-time officers who support our COSLA boards and who engage directly with the Scottish Government, their officers and other representative bodies. We also have a carers representative on our board, and they also influence our deliberations. From COSLA's perspective, autism continues to be a very busy area with a number of reports, lots of recommendations being published in recent times. Engaging with and seeking to find agreement on how to respond to all this activity is an important part of how COSLA works. In fact, it's through our boards that we ensure local authorities are cited and can think about national and locally appropriate responses. Now, that typically involves our officers taking part in reviews and working groups, which seek to work together to improve outcomes. A couple of recent examples of positive outcomes are the updating of the autism teachers and school support staff, and the inclusion of autism-specific training and initial teacher training, which has been developed by Strathclyde University with input from the authors of the Not Included, Not Engaged, Not Involved report. The large number of reports and recommendations can at times feel like a crowded landscape full of different but similar demands. These demands can sometimes misinterpret the roles of Scottish and local government. Local government is a sphere of government, not a tier, which sits below the Scottish Government. We are not just a delivery agent, but we are also employers, commissioners and budget holders who are accountable to our electorate, which includes everyone watching this video. Of course, there are reasons for reviewing practice and reporting processes, and we support doing this within the important stakeholders participating in this conference. The ongoing work to update guidance for schools around restraint and seclusion and reporting on this consistently is an example of this. I think it's fair to say that generally speaking, we do feel services are adequately monitored and inspected, and that calls for more reporting and more monitoring risk diverting our frontline staff to satisfy calls for yet more data. There is also the fact that any such data may be interpreted by some in ways which do not reflect the diverse nature of Scotland in terms of geography and our available resources, which requires a degree of flexibility to adapt to the local context in which services are being delivered. But we fully understand that collecting data which directly contributes to improved outcomes for individuals is vitally important. And we also cannot ignore the common theme of these reports, that there is discontent with what is often seen as a deficit in the support being provided by and commissioned by local authorities, and variation of provision in different parts of this country too. COSLA and our members are keen to address these issues and consider the merits of any reports and any recommendations therein. There are, of course, many competing demands for the services that local authorities can provide, and commission and austerity has meant that resourcing these services is a challenge, and COVID-19 is likely to increase demand for services and place further pressure on our resources. I can assure you, as a local councillor myself, ensure we deliver local services effectively to benefit everyone in my community, as do my fellow councillors across this country, and that COSLA strongly advocates for adequate resources to enable our members to provide services for the communities they serve. The 10-year Scottish Strategy for Autism was launched in 2011 and updated in 2018. Soon it will be time to consider the impact and the effectiveness of this strategy and whether we should produce new autism strategies or take other approaches. These are questions COSLA, Scottish Government, representative bodies and those we are seeking to support to live the lives they want to lead need to discuss and consider as we approach 2021. Moving on to today's theme of this 8th National Conference, which is human rights. The Scottish Government Programme for Government reiterates their commitment to incorporating the United Nations Convention on the Rights of the Child into domestic law. COSLA is fully supportive of this incorporation, recognising it as a unique opportunity to further embed children's rights across a broad spectrum of public services. We will be working with our colleagues from both local and central government to understand how this is best implemented and to help ensure that it is adequately resourced too. We recognise that autistic people are represented within the protected characteristics under the Equality Act 2010 and are seeing a greater focus on taking human rights based approach. With Andy Rome's recent review of autism and learning disability within the Mental Health Care and Treatment Act, and Fiona Duncan's independent care review, both seeking the views of and listening to those with lived experience of the system as it currently operates, and both making recommendations based on what they have heard to make things better. The recently announced independent review of adult social care, chaired by Derek Feely, will also take a human rights-based approach and engage with those with lived experience of using social care, and COSLA fully supports this approach. Of course, this is your conference, and I'm very interested to hear your views on what taking a wider human rights-based approach should look like for local authorities and commission services, and what changes you think local government needs to take to make that happen, and the ways you think taking a human rights-based approach will lead to better outcomes for autistic people. We will feed back your views to our COSLA boards when we look to further develop the position of local government in Scotland on what comes next after the 10-year Scottish Strategy for Autism. Thank you for your time. I hope you get a lot out of the rest of this conference, and thanks again for the invitation.
Thank you, Minister and Councillor Curry, for your contributions this morning. This brings us to the close of this section of the conference. Can I remind you again that all presentations are on the Autism Network Scotland website on the conference page there. We really are encouraging people to engage with the conference and the presentations by asking questions and making comments, and just do that simply through emailing Autism Network Scotland. And we'll be collating and presenting those questions and comments back to some of the presenters later in October. Can I just finish by saying a couple of thank yous. Thank you to Leslie Evans, the Business Development Officer for Autism Network Scotland, who's done 95% of the organising of the conference and the speakers. So thanks, Leslie, much appreciated. Can I thank Cameron's, the event production company, for organising the technical elements of the recording and helping us all through this process. So thank you for watching. Hope you enjoy the conference and its contents. And Annette and I are probably going off for our first coffee and snack. Thank you and goodbye.